Hi everyone, my name is Tanya Escobar, and today I will be talking about heroin. According to the National Institute on Drug Abuse, heroin is an opioid drug made from morphine, a natural substance taken from the seed pod of the various opium poppy plants grown in Southeast and Southwest Asia, Mexico, and Colombia. Some street names include Big H, Horse, Hell Dust, Smack, Brown Sugar, Junk, and Nose Drops. So how is heroin used? People inject, sniff, snort, or smoke heroin. Some people mix heroin with crack cocaine, a practice known as speedballing. So what does it look like? According to the Foundation for a Drug-Free World, in its purest form, heroin is a fine white powder, but more often it is found to be a rose gray, brown, or black in color. The coloring comes from additives which have been used to dilute it, which can include sugar, caffeine, or other substances. It can also be a black, sticky substance known as black tar heroin. And this is what it looks like. So now let's dive a little deeper. Let's discuss some facts in relation to heroin use and people. According to the Centers for Disease Control and Prevention, nearly all people who use heroin also at least use one other drug. As heroin use has increased, so have heroin-related overdose deaths. In 2017 alone, 15,482 people died because of a heroin overdose. Between 2010 and 2017, the rate of heroin-related overdoses deaths have increased by 400%. The CDC also reports that heroin abuse has doubled for Americans ages 18 to 25 in the past decade. Heroin is highly addictive, and people who regularly use it develop tolerance, dependence, and addiction. And this picture shows visually about how people are more likely to be addicted to heroin when using other substances. Now let's talk about the effects on the brain. According to the American Addiction Centers, once the brain encounters these synthetic opioids, it is less likely to produce its own. The more a person takes heroin, the less natural opioid the brain will produce. This affects the opioid receptors and the risk and reward system in the brain, which is a primary pathway that uses dopamine. The brain also decreases how much dopamine, serotonin, and other neurotransmitters it produces because they are released artificially. So it causes it to no longer function normally. And this picture just shows how the brain looks like after heroin use. Now let's look into the withdrawal symptoms. Some symptoms include nausea, shaking, sweating, nervousness, abdominal pain, agitation, depression, muscle spasms, and cravings for drugs. So what are the consequences of using heroin? Let's first look into some of the short-term effects. People who use heroin report feeling a rush, which is described as a surge of pleasure. However, there are other common effects, including dry mouth, warm flushing of the skin, heavy feeling in the arms and legs, nausea and vomiting, severe itching, clouded mental functioning, and going on the nod, which is a back and forth state of mind, conscious and semi-conscious. And people who use heroin over a long term may develop long-term effects, which are insomnia, collapsed veins for people who inject the drug, damaged tissue inside the nose for people who sniff or snort it, infection of the heart lining and valves, constipation and stomach cramping, liver and kidney disease, lung complications, and mental disorders such as depression and antisocial personality disorder. And this is just a visual representation of the effects of heroin on the human body. People who are most at risk with heroin usage are people who have addictions such as prescription opioid painkillers, cocaine, marijuana, and alcohol, non-Hispanic whites, males, and people 18 to 25 years old.